Assalamualaikum and hi everyone. I am Nur Amira, a degree student majoring in chemical science with management. Have you ever heard of a disease called thalassemia? Have you ever done a thalassemia test? Do you know the adverse effects of not doing a thalassemia test? Nowadays, it can be said that many people suffer from thalassemia regardless of whether it is minor or major thalassemia. A thalassemia is an inherited blood condition. It means if you have it, your body has fewer red blood cells and less hemoglobin than it should. Hemoglobin is important because it lets your red blood cell carry oxygen to all parts of your body. Thalassemia is genetic and it happens when you inherit mutated genes from your parents that change your hemoglobin. If both of your parents carry thalassemia, you might get it. And if you inherit 2 or more copies of abnormal genes from your parents, you may get mild to severe thalassemia, depending on what type of protein is affected. Thalassemia have 2 types, which is minor and major thalassemia. Since you already know about the cause of thalassemia, so I would like to invite you all to do a thalassemia test so that you know whether or not you have the thalassemia disease and you can treat the disease quickly before it's too late. I hope that you all stay focused on my description and become more interested in doing thalassemia tests to stay healthy. So, based on my topic, if you are not doing a thalassemia test, the adverse effects of thalassemia can cause bone deformities, enlarged spleen, and heart problems. The adverse effects of a thalassemia can cause bone deformities. Thalassemia, bone disease, is a common and severe complication of thalassemia, an inherited blood disorder due to mutations in the alpha or beta hemoglobin genes. In its more severe form, severe anemia is present and treatment with frequent red blood cells transfusion is necessary because the body has limited capacity on extract ion. Committed ion chelation is required to prevent the complications of ion overload. Thalassemia bone disease is composed of a complex piecemeal of risk factors that include genetic factors, hormonal deficiency, marrow expansion, ion toxicity, and increased bone turnover. The high prevalence of bone disease is transfusion-dependent thalassemia is seen in both younger and older patients as life expectancy continues to improve. Thalassemia bone disease is a composite of not only multiple hormonal deficiencies but also multi-organ diseases. Adults with beta thalassemia may frequently have low BMD, fractures, and bone pain. 36% of patients had a history of fractures and 34% reported bone pain. The solution for this disease is doing a bone marrow transplant from a compatible sibling offers the best chance at a cure for thalassemia. The adverse effects of a thalassemia can cause enlarged spleen. Thalassemia represents a heterogeneous group of inherited diseases characterized by the lack of reduced production of hemoglobin beta chain. The spleen is the organ that makes new white blood cells which fight infection and filter out substances that the body no longer needed. Beta thalassemia causes the spleen to create more new white blood cells and break down more old blood cells than usual. that resulted in the spleen having to work harder. Just as the muscles grow when the body uses them more, excessive use makes the spleen bigger. If a person's spleen is too large due to thalassemia, it is likely that an operational action or splenectomy will leave it. The spleen is part of the body's defense system against them. This organ is tasked with making white blood cells that protect the body from infection. The enlargement of the spleen due to thalassemia causes it to work as it should, so that the person's body is more easily sick. If a person undergoes surgery to lift the spleen, the person is more likely to develop infection such as flu and pneumonia. The spleen is a human organ located on the upper left side of our stomach. Spleen plays many roles in maintaining the functioning of the body in optimal condition. It's located under the diaphragm of the lungs and behind the 9th, 10th, and 11th ribs. Around the spleen, the organs of the stomach, pancreas, and kidneys are located. A healthy human spleen will usually reach 7 to 14 cm in length and 150 to 200 grams in weight. The solution for this disease is patients are advised to avoid easily injured physiques or athletic activities such as football and hockey. The adverse effect of thalassemia can cause heart problems. Among the symptoms and problems associated with thalassemia regarding heart problems are also associated with anemia. Anemia disease can cause the patient to feel tired, weak, short breath, palpitations, and abnormal heart rate. This anemia disease also makes the patient constantly look pale, lesions due to a lack of hemoglobin. Patients with thalassemia have low or normal blood pressures despite their increased cardiac output. This is because they have lower vascular resistance. Lower tonic vascular tone partially compensates for the increased chamber dimensions. The heart and lungs are intimately coupled. Patients with thalassemia major develop mild, non-progressive restrictive lung disease. Inhomogeneous ventilation and small airways disease is common, but diffusion capacity, when corrected for hemoglobin, is normal, suggesting that vascular networks are normal at the alveolar level. The solution to this disease is always do a follow-up at the hospital. So, the adverse effects of thalassemia are very dangerous if not treated as quickly as possible. Thalassemia can be avoided by early detection of carriers as well as avoiding marriage between carriers of thalassemia. So, I encourage everyone to be able to act more quickly to do a thalassemia test for your future and your family members. That's it from me. I hope that you all understand the adverse effects of thalassemia and respond to my persuasion to do a thalassemia test. Thank you.